I mean, and if you'd like to, I'd like to hear your comment on
Oh, I would
why
love
you
to.
think our medicine is safe.
Isn't that so interesting? I agree. Safety is one of the biggest critiques that I feel like is sort of thrown at us. And the irony is that we know that, I mean, what is it, like the fifth cause of death in the United States is medical malpractice in a hospital, or it's mistakes in a, I mean, I'm exaggerating. It might be the 10th leading cause of death, but it is really high up there. We as naturopaths, we don't have numbers like that. We have side effects, but our side effects are good side effects on people, right? Our mortality rate is very, 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 very low. So definitely it's funny when there's this sort of idea of like, oh, you guys are we're sort of like these dangerous renegades. And actually, at the end of the day, like I'm super conservative with my patients. I'm watching their labs like a hawk, right? If anything starts to move sideways, I am on their case. I mean, so
I think the great majority of us, if anything, are
yeah,
a little over
yeah,
cautious and appropriately so. And it's important to
yes,
note that one of our philosophies too is the therapeutic order of things,
yeah,
that we do not discount the importance or the placement of drugs, surgery, and higher interventional therapies, chemotherapy in the case of cancer, that I'm sure a lot of your patients are going through
yeah,
chemotherapy.
yeah. A
So
lot of them are.
that we don't discount that. It's just that
No,
we operate a lot over in these very foundational spaces and sort of work our way to meet these other
yeah,
spaces with
yeah,
people.
yeah. Our higher level interventions are always going to be more effective if our foundations are in place, right? So any surgery for any patient ever, we're going to have better outcomes if that patient walks into it with a higher nutritional status, with lower systemic inflammation walking in, right? With good micronutrients on board, with a plan for adequate rest and repair and healing on the other side. Everyone agrees with that. I think sometimes the oncologists in my area around here are not scared by me anymore, which is really, it's nice. I've made progress. Yeah. Some of them even send patients to me, which is amazing, right? Certainly, I think we're getting to a place where they are becoming a little more open-minded, but it took a long time of me being in this area and the local, conventional doctors seeing that I'm not telling their patients to not do chemo or to not do radiation or to not get their surgery. I'm saying, hey, if your oncologist who is treating your cancer says that this is your best option, I'm going to do everything I can to make sure that you have the very best outcomes and the least side effects, right? So that's super straightforward. And I do have some patients who they don't have any options left, right? They don't have chemo options, radiation's not an option. And what we're doing together in that case is we're saying, okay, no one knows how much time any of us have here, but we're going to make sure you feel as good as you possibly can during the time you have. And we're going to optimize you in every possible way. And, I have folks that wind up way outliving what they were given. Their prognosis, like just motoring along years after whatever. And I see it every day. And I don't think it is a miracle. I do think that is achievable. I don't think it's achievable for every cancer patient. We all have our own unique process, and every cancer is unique in its own way. But I think there is a lot more that can be done to support folks as they're going through treatment, support folks on the other side of treatment. And then, like you see, a lot of your patients are on sort of that earlier end of things where if we don't deal with their complex chronic infections and whatever else they have going on that's keeping their immune system so distracted, they're going to wind up developing a neoplasm. They're going to wind up with some sort of little in a sense, an opportunistic cancer, right? Because their immune system was so distracted for so long.
Yeah, it's really important to work in what we call the continuum here, and we're going to probably spend a whole talk on this sometime, really discussing that continuum, because what will happen a lot of times is if patients aren't treated early with a complex inflammatory illness, they have a risk of developing cancers, and that may be associated with infections and toxin illnesses and all these things sort of progressing into that.
Yeah,
And then
yeah,
if Lauren and the oncologists treat those people and then they go into remission, they have to work their way back too. And so there may still be post cancer care that's needed to prevent them from falling back into that space.
Exactly.
And so this is a big cycle. It's a big circle, a full circle that we want to operate in. So certainly if they reach the cancer point, we don't want that to be the end of their life. And if we are successful there, you know, we want to work them back toward wellness and resilience and obviously quality of life, you know, shed off these fears and anxieties and
Yeah.
traumas and everything, or learn to live, you know, harmoniously with these things. So it's a lot of work. It's a lot of very, very in-depth work, very, very rewarding and fulfilling for us to see, even though it's
It's
quite
true.
complicated.
It's true. You know, and what I always like to just really kind of remind patients too is that whatever effort from my end, they're the ones really, I mean, they're the ones doing the work, right?
Absolutely.
And it's so rewarding to be in those relationships where you feel like, you know, you've got that sort of synergy, your teamwork's going, right? It's like, I love working with folks and we're making recommendations and they're seeing positive outcomes. And I mean, it's what a blast. And what an honor too. So it's really,
Absolutely.
I love what we do. Yeah.